Hello, my name is Jay Wong. I'm a fourth year pathology resident in the United States. I go over cases almost on the daily from head to toe. If you're interested in that, consider giving a like and subscribe. Without further ado, thank you to Path Library for this derm case. So this is an arm lesion in a 60-year-old female. So from low power, I see some acantholysis, right? The epidermis is separating. Now let's delve closer. So it's generally like a suprabasilar intraepithelial acantholysis. However, there is some atypia and with the presence of squamous pearls, as well as mitotic figures here, 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 and as well as a dermal inflammatory reaction. So my differential right here is like a acantholytic dyskeratotic condition like Grover's, Haley, Derriere. But the thing is, you see acantholysis, but you don't see any core bronze and grains. In addition, you see a lot of atypia in the form of atypical mites, as we see here, as well as the presence of keratin pearl. So this can well be an acantholytic squamous cell carcinoma. So there is full thickness atypia present. And so this is squamous cell carcinoma in situ, acantholytic variant. So it's not squamous cell carcinoma, and I may have misspoken when I said, if I said squamous cell carcinoma. But it's only squamous cell carcinoma when it invades into the papillary dermis and reticular dermis, but we don't see that here, but we do see full thickness atypia. So the squamous epithelium shows marked, focally full thickness nuclear atypia with markedly enlarged, irregularly shaped nuclei. Keratinocytes with atypical mitotic figures are identified. These are all features of squamous cell carcinoma in situ. This case shows an acantholytic pattern in which keratinocytes are discohesive and form round rather than polygonal shapes due to loss of connection with adjacent keratinocytes via intracellular bridges. So your differentials include acantholytic dyskeratosis. However, you wouldn't have a degree of atypia this great. And then another differential is herpes and varicella zoster virus, where you can get exuberant inflammation and multinucleated keratinocytes in this case. However, you wouldn't see the cytologic atypia that we see here. The practice question. So acantholytic squamous cell carcinoma has a poor prognosis compared to conventional squamous cell carcinoma. Although this was thought to be true in the past, recent studies have shown that the prognosis is similar to that of conventional squamous cell carcinoma. So, in essence, acantholytic squamous cell carcinomas are composed of discohesive, rounded cells that have lost their intracellular bridges with adjacent keratinocytes. Well, that is it for today. I'll see you all next time. Bye.